Whooping cough cases are raising health concerns tonight. According to the CDC, 4,864 cases have been reported across the country so far this year. That's about 3 times higher than this point last year. A sharp increase in cases is even being seen right here in Pennsylvania. Earlier this week, we told you about some local schools dealing with outbreaks, and now we're getting a closer look at the numbers in our area. I spoke with a UPMC doctor about what you need to know to keep your kids and families safe. No parent wants their child to suffer with pertussis, also known as whooping cough.
It's contagious from the very start of symptoms, from those head cold-like symptoms of runny nose and sore throat, and it's contagious through the coughing period.
That's why UPMC's Infection Prevention Medical Director, Dr. Graham Snyder, is concerned about the surge in cases happening nationwide. According to the CDC, 601 whooping cough cases have been reported in Pennsylvania this year as of May 25th. That's up 456% from the 108 cases over the same time last year. The Allegheny County Health Department tells KDKA it has 19 cases so far this year, 10 of them confirmed just this month. The infection has reached some classrooms, including the Plum and Mount Lebanon school districts. Dr. Snyder says most patients recover, but
It can be severe and potentially even life-threatening, particularly for very young kids. Infants who are just a few months old are particularly vulnerable, and for people who are older, age 65 or older, and or have existing lung conditions, for example, COPD or moderate or severe asthma. In these cases, this severe cough can be more than just a bad cough. It can cause people to have low oxygen levels and become seriously ill.
it may seem like a usual cough at first, then it gets worse to coughing fits, followed by a whooping sound.
The coughing can be so severe, it can cause shortness of breath, it can cause vomiting after the cough, and is incredibly uncomfortable to have.
The serious cough can last for weeks. While treatment can shorten it and the time a person is contagious, Dr. Snyder says it's important to be up to date on the vaccine because it's the best protection against this highly contagious infection.
And while it's not perfect at preventing you from getting pertussis, it can still reduce the chance that you have serious complications of the infection or a more serious infection and reduce the risk that you spread to others.
So when should you see a doctor? If a severe cough lasts more than a few days, even if you've been vaccinated against pertussis, and if you've been exposed and start showing any symptoms, even mild ones like a cold.